Welcome back. Medicare open enrollment ends this Saturday, but there's still time to decide on the best coverage to fit your needs. AAA Medicare sales manager Alyssa McGovern here to tell us what you need to know ahead of that important deadline. Alyssa, thanks for joining us this morning. Who does Medicare benefit here?
So typically Medicare is a federal program for folks that are 65 and older. There are some other folks that qualify, but most everybody is 65 and older.
And so what's the process of open enrollment, and who should be taking a closer look at their policy?
Yeah, that's the right question. So annual enrollment is the time of year anyone that's Medicare eligible can shop. And we recommend everyone look this year at the letter that they got from their carrier, because usually folks are used to rolling over if they like their plan, but they really should be looking to see if there were any changes that impacted them and shopping to make sure they're in the best coverage still.
And for free, you help them take
Yes.
a look at the best plan based on their needs. Talk to us about what you're seeing in your office.
Yeah, so it's just another way AAA has you covered. We see folks come in and we look at their needs, their prescriptions, doctors, and a lot of folks are coming in and finding that they might not be on the coverage that's the most cost effective. In a time when every dollar counts, we're able to find different policies with better coverages and maybe even some cost savings depending on your situation.
Talking about a gentleman, in late stages of cancer, was paying for everything out of pocket. Talk to us about how you were able to help him after looking at his coverage.
Yeah, so we were able to look at his coverage and find a policy that would allow him in-network cost, which saved him a significant amount of money, thousands of dollars that he didn't expect to be able to save based on his situation. So I would say don't assume that there's nothing that can be done for the situation you're in. We're here to help everybody, whether you're a AAA member or not. You're a member of our community and there might be something better out there for you.
What are some of the most frequently asked questions you're seeing?
Yeah, so most of the questions we're seeing are about prescription drug costs. So this year and every year, the tiers change, the costs change. So a lot of folks are wondering, is my prescription still covered? Is it still the same cost? And have my costs changed? And so we can walk through your particular coverage and compare it to the 10 carriers that we shop and make sure you're still getting the best value.
Especially because these are some of the most vulnerable people out there. So talk
Absolutely.
to us about why it's so important, to help Medicare patients.
Yeah, it is so important to us because, it's often hard to figure out who do I turn to, who do I trust, and AAA is really built to take care of the community, and that's what we're here to do. And if you're in the right plan for you, we'll tell you that too. That's really what we're here to do, is look at your needs, your plan, and evaluate and make sure that you are getting what's best for you, and give you those options.
I know that the deadline is tomorrow. Can folks get in today? Are you open tomorrow? Talk to us about availability.
Yep, so we're on a wait list right now, but yesterday we were able to get some people off of that wait list, so we're really trying to see as many people as we possibly can. I would recommend you look at that letter you got. If you can't find it, give us a call. We can tell you what the situation is. Some folks are experiencing that their plan is removed from market. We can help you figure out if that's you, if you're affected, and we still do have room to help out, so please do give us a call or go to our website, AAA.com/Medicare, and we want to help as many of the Western New York community as we can.
Alyssa McGovern with AAA, thank you so much for joining us this morning. Mike is back with a check of the forecast when